Okay, so today we will going to learn about tetanus. So first, what is tetanus? Tetanus is the bacterial infection which is not contagious, meaning it does not spread from person to person. Like an example of COVID-19, it spreads from person to person, but does not spread. It enters the human body through injuries. Tetanus spreads from injury from metal objects like plates, rusty nails, knives, etc. But mostly rusty items are the culprit, and mostly rusty nails are sold because the tetanus is found in soil, leaves, and manure. So, in the soil, mostly all the metals covered are rusted, and so as tetanus bacteria lives in areas which have little oil, very little oil, no oxygen. They can come in rusty items, and then when they are come in contact with an highly oxygenated area, they form into spores. And when those spores enter in our body, the tetanus spores become like bacteria, releasing many toxins. One of the toxin is tetanospasm toxin. So here is explained that this is a motor neuron which have two neurons. These neurons take messages from the brain, convert it into electric signal, and send it to motor neuron, and motor neuron send it to muscle, which make the movement. Imagine if there is a spider on your hand. Well, most of the people are not afraid of spiders, but some are. So your brain, so your eyes senses, your eyes sees that there is a spider on your hand, and they send this electric signals to your brain. Then the brain sends electric signals to your arms auxiliary nerve. This is called auxiliary nerve. Or neuron. And so the auxiliary nerve converts the brain signal into electrical charges and sends it to motor neurons. And here the motor neurons make and then the motor neurons send the message to the muscles which make the movement. So then after the spider has gone, the motor neuron sends another message to this neuron. I will tell the neuron's name in next video, and then it sends the electrical signal to the motor neuron, and then it sends to muscles. So the spider has gone out of the hand, so please stop moving, and your muscle is now at rest, meaning it's doing no movement or very little movement. So when tetanus toxin comes, it acts like a blockage for this neuron. So your auxiliary nerves keep firing, which can cause intense spasm. So now let's go into the causes. When this cause I tell you in the starting of the video, so I will start directly from the second cause, which is insect or animal bites. So any insect or animal bites, well, tetanus does not come from like touching any surface which is contaminated by the virus and touching virus or bacteria and then touching eyes, nose or mouth. nor it comes from another people who has been infected from their saliva or 20% coughs. So tetanus always needs a open wound to come inside the body. And after that, the symptoms are, first there will be fever and some mild symptoms like fever, etc. And when the tetanus toxin reaches to our central nervous system, which consists of the brain and the spinal cord. So here, then painful muscle contractions and stiffness happens. But first, you have been asking in which part of the body has that been started. You all have this doubt in your mind. Well, most of the people. First, the joint, neck, show these symptoms. But when tetanus toxins spread throughout the body, more muscle groups become more rigid, particularly in the jaw and neck. Next is jerking or staring, difficulty opening the mouth, painful muscle spasms, and even arching of the back. In this diagram, the diagram is shown. Let me also do a practical. Like this, a person will be with arched back. And next, we can also have painful muscle spasm, which are triggered by loud sound, touch, and even light. Next is increased heart rate and increased blood pressure, which we say in Hindi, like that. And next is excessive sweating. These all are the symptoms. And next complications are, number one, reason, difficulty opening mouth. Number one complication is tooth decay. Well, because we have difficulty opening the mouth, so how we can brush our teeth. So because of that, tooth decay may happen. And malnutrition due to low nutrition and like that. And number two, reason is spasms. Well, if the spasms is very strong, it can also break bones. So doctor may diagnose by physical examinations like arched back, temperature, difficulty opening the mouth. And next, they will take spatula test. Spatula means spit, or which we say tooth in Hindi. That the doctor will take the sample from our mouth and then he will test. And now, treatment number one, medications. There will be mostly antitoxins, antibiotics, muscle relaxants, and the vaccine. And next is therapy. Ventilation will only be the therapy. The treatment may go for course of weeks. And so
this to manage the disease, not the cure the disease, right?
Yeah, treatment is to manage the symptoms. It can also be to cure the disease, and also the person may also die from. And so if tetanus bacteria once enters in your body, there is no you can't cure the disease. Only you can manage symptoms. So the best way to not you have listen to hearing, prevention is better than cure. So prevention is getting tetanus injection after you got injury from any metal item, if it is rusted or not rusted. And number two is tetanus vaccine. So first, you will get T-TAP vaccine, diphtheria, tetanus and pertussis vaccine, which is till 6 years. say to 6 to 9 years mostly. And then next is Tdap, tetanus, diphtheria and pertussis, which is for preteens like 10 years till 12 years. And next is TB, tetanus and diphtheria or Tdap, which is for teens and adults. You will get this every 10 years. So, if you get any injury from a metal item, you must get a tetanus injection within 48 hours, which if we need to check how many days. So, we will do division, which equals to 2 days. In 2 days, you must get the tetanus injection, and the tetanus vaccine impact will be till 6 to 8 months. Means after 6 to 8 months, if you get injury from metal item, again you need to take this tetanus vaccine. So, thank you. Please like and subscribe my video, and bye bye.